in a turtle to send blood to the brain and back, beginning in the deoxygenated blood in the sinus venosus. Blood would pass to the right atrium, to the single ventricle, which could have a partial septum, which would partially separate the oxygenated from the deoxygenated blood, to the pulmonary trunk, to the pulmonary artery, to the pulmonary capillaries where gas exchange occurs and the blood is oxygenated in the lungs. The oxygenated blood returns to the pulmonary vein, to the left atrium, once again to the single ventricle, to the ascending aorta, which then on the right side forms a brachiocephalic trunk, but not on the left, before forming the subclavian artery. The common carotid artery comes off the subclavian artery and will form the internal carotid, which services the brain. After gas exchange occurs in the brain, deoxygenated blood will return through the internal jugular to the precava, or anterior vena cava, to the sinus venosus, where it can return to the right atrium. In this close-up of the heart, one can trace blood flow through the atria, the ventricle, and the arteries. The veins would enter on the opposite side of the heart. And so one can see that from the right atrium, blood would go into the single ventricle, although the deoxygenated blood was largely separated from the oxygenated blood. It would then enter the pulmonary trunk, which goes to the lungs. This pulmonary trunk or common pulmonary artery then leads to separate right and left pulmonary arteries. Pulmonary veins return, both entering the left atrium, and then from the single ventricle, the ascending aorta, then not only forms aortic arches, which go to the inferior portion of the body, but then the subclavian arteries, which not only go to the arms, but also serve as the route for the common carotid. On the right side, there is a short brachiocephalic trunk before the subclavian branches off.